Addisons? Bless you. Addison's disease. It sounds like something you'd say after someone sneezes on a historical document. Did you just sneeze on the Declaration of Independence? Oh dear, you have Addison's disease. But in reality, it's a real medical condition, and no, it's not contagious. It's a hormonal disorder that messes with your adrenal glands. These glands are like the energizer bunnies of your body, but instead of drums, they produce hormones. These hormones are super important because they help your body deal with stress, regulate your blood sugar, and do a whole bunch of other behind-the-scenes work. Now imagine your adrenal glands decide to take an extended vacation. That's kind of what happens with Addison's disease. The glands don't produce enough of those essential hormones, and it can really throw your body for a loop. So, if you're feeling tired all the time, craving salt like it's going out of style, and your skin's looking a little more bronzed than usual, well, you might want to keep reading. We're going to break down Addison's disease in a way that's easy to understand, even if you slept through your high school biology class. No judgment here. Exhausted? It's not just Monday. Let's talk about fatigue, folks. We all get tired. It's a fact of life, like taxes and awkward family gatherings. But the fatigue that comes with Addison's disease, it's a whole different ballgame. Imagine trying to run a marathon after pulling an all-nighter and forgetting to eat breakfast. That's the kind of exhaustion we're talking about here. It's the kind of tired that makes you want to crawl under your desk and take a nap, even if your boss is walking by. So if you're constantly feeling wiped out, like you just ran a marathon in flip-flops, and a good night's sleep doesn't seem to help, it might be a sign that something's up. Of course, being tired all the time can be a symptom of a lot of things, not just Addison's disease. But it's definitely something to pay attention to, especially if it's accompanied by some of the other symptoms we're about to discuss. Next up on our Addison's disease adventure, tummy troubles. Yes, unfortunately, this condition can also mess with your digestive system. We're talking nausea, vomiting, diarrhea, the whole 9 yards, hopefully not all at once. But here's the thing, and this is where it gets interesting. People with Addison's disease often crave salt. Like, really crave it. They want to put it on everything. Their cereal, their ice cream, their significant other. Okay, maybe not that last one. Why the salt obsession? Well, remember those adrenal glands we talked about? The ones that are on vacation? They're supposed to help regulate your body's salt and water balance. When they're not doing their job, your body starts to crave salt like crazy. So, if you find yourself constantly reaching for the salt shaker or daydreaming about potato chips, it might be a good idea to mention it to your doctor. Dizzy? Maybe it's not the tequila. Feeling dizzy? Lightheaded? Like the world is spinning even though you haven't had a drop of tequila? Yeah, that's another fun symptom of Addison's disease. It happens because the lack of cortisol, one of those important hormones your adrenal glands aren't making enough of, can cause your blood pressure to drop. And when your blood pressure drops, guess what? You guessed it, you feel dizzy. This dizziness can be especially noticeable when you stand up quickly after sitting or lying down. It's like your brain momentarily forgets how gravity works, and you feel like you're going to pass out. Now, I'm not saying you can't enjoy a margarita every now and then, but if you're constantly feeling dizzy, especially when you stand up, it's definitely worth getting checked out by a medical professional. Here's a weird one for you. Addison's disease can actually make your skin darker. It's like getting a tan without the sunshine or the risk of skin cancer. Sounds great, right? Well, not so fast. While it might seem cool to sport a year-round tan, this type of skin darkening, known as hyperpigmentation, isn't exactly something to celebrate. Remember how cortisol is one of the hormones your adrenal glands are supposed to be pumping out? Well, when cortisol levels are low, it can trigger your body to produce more melanin, which is the pigment that gives your skin its color. This darkening can be more noticeable in certain areas, like your knuckles, elbows, knees, and scars. You might also notice it in your gums and the creases of your palms. So, if your skin's looking a little more bronze than usual, and you haven't been spending any time in the sun, it's definitely something to bring up with your doctor. Okay, so we've talked about some of the symptoms of Addison's disease, but what's actually going on inside your body to cause all this craziness? Remember those little powerhouses called adrenal glands? They're located right above your kidneys, and they're responsible for producing a whole bunch of important hormones, including cortisol and aldosterone. Cortisol is often called the stress hormone because it helps your body deal with stress. Go figure. It also helps regulate your blood sugar, blood pressure, and immune system. Aldosterone, on the other hand, is all about balancing the levels of salt and water in your body. It tells your kidneys how much sodium to retain and how much potassium to excrete. Now, with Addison's disease, your adrenal glands aren't producing enough of these vital hormones, and when your body doesn't have enough cortisol and aldosterone, it's like a car trying to run without enough oil. Things start to go haywire. In the next section, we'll delve into some of the causes of Addison's disease. Get ready to learn about autoimmune disorders, infections, and more. One of the most common causes of Addison's disease is an autoimmune disorder. Now, I know what you're thinking. An autoimmune what now? Don't worry, I got you. Think of your immune system as your body's own personal security team. They're supposed to protect you from all the bad guys out there, viruses, bacteria, you name it. But sometimes, your immune system gets a little confused. It's like they accidentally picked up the wrong training manual and started mistaking your own cells for the enemy. In the case of Addison's disease, the immune system mistakenly attacks the adrenal glands, damaging them and preventing them from producing enough hormones. It's like your security team accidentally shutting down the power grid. Not good. Why this happens, nobody really knows for sure. It's one of those medical mysteries that scientists are still trying to solve. But what we do know is that autoimmune disorders are more common in women than men, and they often run in families. So, if you have a family history of autoimmune diseases, like type 1 diabetes or rheumatoid arthritis, it's a good idea to be aware of the symptoms of Addison's disease. Other culprits, stress, infections, and more. Autoimmune disorders are the most common culprit behind Addison's disease, but they're not the only ones. There are a few other things that can damage the adrenal glands and lead to this condition. One of them is infections, like tuberculosis. TB is a bacterial infection that usually affects the lungs, but it can spread to other parts of the body, including the adrenal glands. When TB infects the adrenal glands, it can cause inflammation and damage, leading to Addison's disease. Another possible cause is bleeding in the adrenal glands. This can happen as a result of severe trauma, like a car accident, or it can be a side effect of certain medications, like blood thinners. In rare cases, Addison's disease can also be caused by genetic disorders. Certain genetic disorders can affect the development and function of the adrenal glands. Tumors, while rare, can sometimes lead to Addison's disease if they develop in the adrenal glands or the pituitary gland. It's important to note that these other causes are much less common than autoimmune disorders. But if you're experiencing symptoms of Addison's disease, it's crucial to see a doctor to get a proper diagnosis and discuss potential causes. Time to see the doctor. Don't worry, it's not as scary as it sounds. Okay, so you've been experiencing some of these symptoms, and you're starting to think you might have Addison's disease. What's the next step? Well, it's time to put on your brave face, or maybe just a cute outfit, and head to the doctor. I know, going to the doctor isn't exactly everyone's idea of a good time, but trust me on this one, it's important to get checked out. The sooner you get a diagnosis, the sooner you can start treatment and start feeling like yourself again. The doctor will probably ask you a bunch of questions about your symptoms, your medical history, and your family history. They might also want to do some blood tests to check your hormone levels. Don't worry, it's just a little prick, unless you're afraid of needles, in which case, I apologize for the trigger. Once the doctor has confirmed that you do indeed have Addison's disease, they'll work with you to come up with a treatment plan. Treatment. It's like giving your adrenals a helping hand. Addison's disease is manageable. Your doctor will develop a treatment plan for you. The goal is to replace missing hormones. This is usually done with medication. You'll likely be prescribed corticosteroids. Take them daily to keep hormone levels stable. Lifestyle changes like a healthy diet are also important. Load up on fruits, vegetables, whole grains, and lean protein. Stay hydrated. Drink plenty of water, especially when exercising or it's hot. Manage stress with exercise, yoga, or meditation. Work closely with your doctor to feel your best. Living well with Addison's, you got this. Getting diagnosed with a chronic illness like Addison's disease can be overwhelming at first. It's like your body just threw you a curveball and you're not sure how to catch it. But here's the thing. You've got this. With the right treatment and support, you can live a full and active life with Addison's disease. Remember to take your medication as prescribed, listen to your body, and don't be afraid to ask for help when you need it. Whether it's from your family, friends, or a therapist, having a strong support system can make all the difference. And hey, if you ever need a laugh, you know where to find me. Remember, laughter is the best medicine. Well, besides actual medicine, of course. Stay strong, stay positive, and keep on shining.